As we become more COVID resilient, we are now able to take further steps to adjust our measures. So first, we will remove mask wearing in indoor settings from 29 August.
The wearing of masks indoors will be largely optional from next Monday. This brings to an end the mandatory wearing of masks announced more than 2 years ago on April 14, 2020. I'm Lin Li Fu and this is ST Live. Now first, mask wearing in indoor settings will not be required from Monday, August 29. There are two main exceptions: healthcare facilities, residential care homes and ambulances, and on public transport. This covers the MRT and LRT and public buses. Mask wearing on private transport as well as school buses, private bus services and taxis will be optional.
You may ask, why specifically these two settings? And the reason is that we have identified areas where essential services are being carried out in enclosed and crowded spaces and which are frequently used by vulnerable persons. So enclosed, crowded, and frequently used by vulnerable persons, especially essential services. And that's why, based on these considerations, we identified healthcare and public transport.
Young children between 5 and 11 years old can get a booster dose by the end of the year. This will be after the exam period and before a potential year-end wave of new cases, says Health Minister Ong Ye Kung. Infants aged 6 months to 5 years old could be receiving vaccinations too. A decision on recommendations by the Vaccination Expert Committee is expected soon.
The HSA, or Health Sciences Authority, they have authorized Moderna's Spikevax COVID-19 vaccine via the PISA route avenue, which is the Pandemic Special Access Route to children, including very young children aged 6 months to up to 5 years old. The current data showed that the benefits outweigh the risks. To illustrate, for the Moderna vaccine trial involving 6,000 children, there were 0 cases of myocarditis as well as anaphylaxis. And there's 1 case of febrile convulsion, which is likely related to the vaccine. So based on the trial, the incidence of severe adverse reaction has been very, very low.
And a task force stressing today that the pandemic is not over and Singapore will continue to prepare for possible future infection waves, including a northern hemisphere winter wave. In a nutshell, we have to be ready.
In the past, a small proportion of our population has been infected with COVID-19. So when a new variant arrives, it will infect those who have not been infected yet, what we call COVID-naive individuals, and then it cause a big wave. And that has been the case for Delta, first Omicron, and then the second Omicron driven by BA.5. But now, based on our latest serology study by MOH, we estimate about 70% of our population has been infected with COVID-19 already, which means we now have far fewer COVID-naive individuals, which means when the next wave comes, and if it's a big wave, it must comprise many reinfections. It will be a reinfection wave. That is why we have been monitoring reinfection numbers closely, because it will give us an idea of when the next wave can happen.
Overall, while the situation is much better today, we also must be mentally prepared for any sudden change, because we don't know how the virus will mutate and what the next variant will look like. It may be milder, and we certainly hope it is, but it could also be more aggressive and dangerous. And that's why we are not standing down the MTF. We are continuing to monitor closely, and we have drawer plans in place for various contingencies, including scaling up of our healthcare capacity, as well as stepping up vaccination operations if and when the need arises.
Do visit straitstimes.com for more on today's announcements and tune in to The Big Story at 5:30 p.m. You can also watch the full media conference on our YouTube channel. I'm Lin Li Fu. Thanks for watching.